Hey, this is Dr. Stone, and I wanted to share a short video on fibromyalgia with you. If you've been watching me at all, as you know, I do a lot of research on fibromyalgia. It's one of the conditions that I have a passion for and a compassion for the people who have fibromyalgia. I grew up in Minnesota, and the Mayo Clinic is quite a presence in Minnesota, and it really is quite a presence nationally and internationally. The kings and queens fly to the Mayo Clinic, and I imagine that some folks with fibromyalgia say, boy, if I could only afford to go to the Mayo Clinic and get the best the world has to offer in medicine. And I just went to their website just to see and compare what we do, because I think what we do is more comprehensive than the Mayo Clinic, and I was proven accurate on that guess. So Mayo Clinic, by definition, says fibromyalgia is, this is their definition: you hurt all over and you frequently feel exhausted. Even after numerous tests, your doctor can't find anything wrong with you. You probably have fibromyalgia. So I have never treated a fibromyalgia patient where I couldn't find lab tests that were abnormal. Whether it's the adrenal stress index, which they're not going to run probably, hormones. The last person with fibromyalgia that I worked up had elevated estrogen, elevated testosterone, elevated progesterone. Every one of her steroid hormones were elevated. That doesn't feel good. So it was a unique cause, and we had to come up with a unique solution to get those back down. She also showed she showed a healthy adrenal stress response. So her stress physiology was maintaining, but her immune system was trashed. We did a lab called the T and B lymphocytes and natural killer cell panel, which is our autoimmune panel, and sure enough, her immune system was way out in left field, which creates lots of inflammation and the tender points that you experience with fibromyalgia. So on MayoClinic.com, they say causes. Well, of course, doctors don't know what causes fibromyalgia, but it most likely involves a variety of factors, including genetics. So that's kind of the medical, punt is, well, we're just going to blame it on genetics. Infections and trauma. So inflammation and these are actually two of my four stress causers. So the things that cause stress into our body result in dysfunction. Fibromyalgia is a dysfunction, of course, of the parietal lobes, the inflammatory systems, pain perception. So I think they're on, but what are they going to do to treat it? So if you have trauma or infections, or if you have bad parents, genetics, they're going to treat you with analgesics. They're going to treat you with antidepressants, anti-seizure medications, and which includes Neurontin and the new one, Lyrica, which they share as the first drug approved by the FDA for fibromyalgia, and it's an anti-seizure medication. So, and of course that's going to affect GABA, which is, alcohol is a GABA drug, Valium is a GABA drug, so it's going to dampen areas of your brain, which, could help, but it doesn't get to the, the infections, the trauma, and the other two sources of stress, which I've mentioned, the immune system, autoimmune, those kind of things. And they don't dig into what the inflammation is all about. The inflammation can be immune cytokines, it can be prostaglandins and leukotrienes, which are hormones released from every cell in your body, including muscle cells, release prostaglandins, and histamine, so food sensitivities. We do food sensitivity testing to see where that inflammation is coming from. Toxicity would certainly cause inflammation, because it would activate the immune system as well as just make your body very toxic. And a toxic body is a swollen body, and a swollen body starves your cells of oxygen. So There's a lot we can dig into. We can, get rid of the swelling. We can treat the cause of the stress. So, just wanted to share, and maybe save you about $20,000 in visiting the Mayo Clinic to get your analgesics and antidepressants and Neurontin and Lyrica. So, thanks for listening.